everybody, and welcome back to another episode of The Main Line. We are here every Wednesday at 6 p.m. Thanks for joining us again. Today, we have a really special presentation by one of my favorite companies in Maryland, one of my favorite families in Maryland. I'm here to introduce Curio Wellness, Rebecca, and Wendy. How are you guys today?
I hope.
Hi, great.
Good to
Hi.
see you.
Yes, great to see you too. So I'm so excited to have you guys on today. You're a family-owned business just like mine, and I think people need to learn more about your family. You know, we know all about all the amazing products that Curio has, and we're going to learn a lot more about them and how they're made today. But first, before we get started, I want to learn a little bit more about you guys individually and how you got into the cannabis industry. So whichever one wants to start, you guys can tell them a little bit about who you are, and if you guys haven't figured out, they're sisters.
I'll let Wendy start.
Okay. Because I'm older. No, I'm just kidding. The journey started for us when O'Malley first passed the law here in Maryland, and that sparked the interest in this space. And a group of us kind of started what I would call a nights and weekends project. We all had other lives and other jobs of doing the due diligence of looking into coming into this medical cannabis market, and ultimately led to drafting the application and submitting it, all of that. And our family itself was involved in that behind the scenes process in the beginning. While that was happening, I lived my old life, which was in television. I'm a former TV producer and editor. I was on the creative services side of the business. My last role was as creative director for Live with Kelly and Michael. I did all of their on-air promotions that were pushed out nationally. But then I left television in 2016 to move back to Maryland and start this business.
Awesome.
So Wendy's being a little modest. She was at I would say a turning point in her career, and she was the one who was paying attention to the laws in Maryland. And our dad, Michael, who's our CEO, has a background in healthcare and pharmaceutical drugs, but specifically institutional pharmacies, which is large scale distribution for nursing homes. And she contacted him and said, I'm really looking to make a change. You are technically retired, but are terrible at being retired, and we can't deal with you not working. So we think that we should, I want to start this business with you. I think we should get into it. So after a lot of due diligence, the two of them were able to find a path forward through the regulations, convince many smart people that this was a business that they should both invest in and come and be a part of our team. And we shipped our first product in December of 2017. And in June of 2018, I joined the team. My background is in fine art sales. And so I was working for an arts website that is based in New York City, and essentially got a call from my dad. And he said, listen, I know you can sell art, but we're about to go from having about 30 dispensary customers to twice that many. And I want to build out a bigger sales team. And so can you sell medical cannabis? Can you sell the Curio products? And I was like, well, I certainly can try. And he said, well, the one caveat is don't leave your company in a huff. Make sure that you maintain the relationship, because I'll give you 90 days. And if it doesn't work, you're fired and you got to go back to that art world business. So it's nice to be able to work for family because they don't sugarcoat anything.
No, they don't. Yeah, my mom and I are the same. And, I've always felt like I could really relate to your family and your business. We're both very educationally based and rooted in the medicinal properties of the plant. And then on top of that, just your story, your inception story is very similar to ours. So I've always really loved that. And I love what you guys have built. And I'm excited to learn more about it today.
Thank you.
So I will let you guys get to it.
All right. So we gave you a little bit of taste of this just now, but this is the whole family. My sister and I have a brother. We're all married and have children. And of course, there are parents. So our father, Michael, is the CEO. I'm the chief brand officer, and Rebecca is the chief revenue officer. As Rebecca mentioned, we were the first to ship to dispensaries in Maryland in December of 2017, and we're the only GMP certified medical cannabis grower and processor in Maryland. That distinction really has to do with our process and how we produce products, and Rebecca's going to elaborate on that, but it became pretty pivotal right now when the edibles regulations came into effect.
So what we like to say is we've raised the standard of relief, and that's because having CGMP certification is not a requirement in Maryland. It stands for Current Good Manufacturing Practices, and it is a set of guidelines that the FDA uses to assure that products that are made in the food and beverage industry, for example, are safe and effective. And what it requires is very strenuous process planning, having incredibly detailed SOPs around how your products are made, and having accountability of training your employees and retraining your employees so that products are made to those same specifications time and time again. The reason that this is important to Curio, and it's frankly been a part of our mission from day one, is because we believe so strongly that we are creating medicine. And in any other industry, pharmaceutical or otherwise, you'd have to have a repeatable process to make sure that the end product that you're selling to a patient is exactly the same every time, so that they can come to trust the effects that they will get when they medicate with that product. So that is kind of our touchstone, our port in the storm, if you will. When it comes to how we make products, having that CGMP certification was something that we always endeavored to have, because we knew that it would keep the integrity of our products whole.
So all of you in PG County, if you're watching, you may not read the Baltimore Sun. So we wanted to make sure that you are aware of their recent awards feature around the cannabis industry. We were really excited to see that the chew, vape, and pill categories all had winners. You're probably familiar with our chews. They've been around for a bit now, and they come in a variety of flavors and potencies. Good Night is a product that we released in the last year after doing a lot of research on the sleep needs of patients. And it has a special technology that allows you to help fall and stay asleep. And of course, the O Vape is well known for its aphrodisiac properties that helps both genders, and it is a patient favorite across the state.
So we wanted to dig in, or drill down, if you will, on those products. One tenet of our medicated chew line is that we appreciate that patients want variety. They want different flavors, they want different potencies. So back in, I think it was December of 2018, we released an apple spice limited flavor, and it only came in one potency. And what we learned from doing that was, patients would tell us, I would love to see more flavors, and I would love to have this in a variety of potencies so that it's the right dosage for me. And so we took that feedback and we roll out a new limited edition flavor once every quarter. So at the beginning of this year, we introduced mulberry matcha. Our strawberry basil, which was released last year in 25 and 40 milligram potencies, is currently available. And we added the 10 milligram potency to the mix because we love Hope and we love the Marion, Maine community. You get a special inside kind of sneak peek that our summer LTO flavor will be pineapple mint, and that will debut the week of June 28th. Right before 4th of July. And then we are going to determine what our fall flavor will be. It might be apple spice. We might bring in something new, but patient feedback is really crucial to our product development process. And so you'll start to see on Instagram, if you follow at Curio Wellness, that we want to know what flavors patients want, because we can genuinely make anything we put our minds to. We do flavor trials to make sure that the product tastes great through our own dispensary. And in addition to these limited time flavors, we also were getting patient feedback that there was not a both diet conscious and diabetic option for a chew on the market. So we went to work developing a sugar-free version, which actually debuts May 24th. The mango ginger 10 milligram is going to start being available in the market. And then 2 weeks later, blood orange turmeric, and 2 weeks after that, lemon honey. And we've started in a place of, we want to have something for everyone. We know some patients are THC only, others prefer a higher amount of THC with a little bit of CBD, which is our blood orange turmeric line. And then the lemon honey is the CBD potent, less THC version. So our sugar frees are just another example of how the patient feedback loop really genuinely informs our process. And we also wanted to fill a void in the market, which is something that's for health conscious patients. And then again, something that people who struggle with their the amounts of sugar in their diet would have something in a chew dosage form to be able to medicate with.
I just want to pop in and say that our patients absolutely love having all of those options. So I'm sure everybody who's watching right now, Curio really has a wide variety of products for everybody, like Rebecca was saying. And I really love that about you guys.
Thanks. Well, I also wanted to say that I was in the tasting trial and can validate that if you are familiar with the original versions, these taste basically identical to those. So you wouldn't really notice a difference in flavor. You just lost the sugar factor, which is great. And also, there's been a lot of conversation lately when the edibles regs came out, and we've seen that CGMP sticker featured on both of these slides related to chews. And it's important to note that the Curio chews are not, they do not fall under the edibles regulation because of their dosage form and our approach, and most importantly, our CGMP certification. They're exempt from those regulations, which means we'll be able to continue to deliver them at those doses above 10 milligrams for the future. So no stopgaps in that product line for anyone. Good night. All right. Everybody who can't sleep, listen up. This product has been developed over the last probably 3-4 years at this point. We have a scientific advisory board that meets quarterly. Actually, tomorrow is the meeting for this quarter. And that group is made up of research scientists and physicians from Hopkins, Maryland, Duke, University of Florida. And these individuals get together and we talk about the condition-specific products we want to create using cannabis as the active ingredient, and how we can create a dosage form that meets the needs of the symptoms that patients are having. So Good Night is the first product we released, and we talked to a lot of patients, and we heard what the issues were with not falling asleep, not staying asleep, not wanting to take prescription meds that were leaving you with a hangover the next day. And on the cannabis side, what they were using and how it worked and or for how long. And so what's really great about this tablet that we've created is that it's a cannabis is the active ingredient. So it's a 10 milligrams of THC and 5 milligrams of CBN. It's inside of a tablet that's scored, so you can break it in half and get the same effects with half the dosage. That would be a 7.5 gram dose if you break it in half. And inside the pill, it has what's called a pulse release technology. And that's due to one of the pharmacologists who sit on our scientific board. And what that does is it allows the medicine to give you an immediate dose when you take it, and then another pulse of the medicine 3 hours later. And that's what's helping people not only fall asleep, but stay asleep. And we did this as an independent trial before we released it. We worked with a company called Sleep Score Labs. We had certified Maryland patients taking the product and monitoring their sleep with an objective device that sat on their bedside. And we got the data back that showed that the product did what we wanted it to do, and people had improved sleep. They got up less at night. If they did get up for things like going to the bathroom, they went right back to sleep and were really not disturbed. And when taking their proper dose, they never had any issues the next morning in terms of that hangover feel and grogginess that people can have. So we really think it's a great solution for the cannabis patient. And we know that many people are plagued by sleep, and that sleep can really be, it's very restorative and it's additive to whatever you're dealing with. So if you can reset at night and let your system reboot, so to speak, you're well poised to deal with all of the other things you have the next day, and even have some of your other symptoms be mediated to a certain point.
I would also add that we have received patient feedback where there's concern that the dosage is too low because it's only 15 milligrams of total cannabinoids. But I encourage patients to give Goodnight a try, even if they have been medicating with a much higher potency at night, because that combination of THC and CBN combined with the pulse release technology is kind of greater than the sum of its parts. And in addition to that, we have an offer as our Curio, we call it our Curio Patient Promise, which is that any patient who tries a Curio Wellness product and is not satisfied with the results can get their money back or a credit towards a different Curio product, no questions asked. So we want to take out the risk of trying something new, because we totally appreciate that once you have a solution, it's very hard to want to try something else, frankly, because it's expensive to try something else. So we extend that benefit to patients so that we can take away the risk or the trepidation and just allow you to openly experience the benefits. And hopefully you'll find something new that works for you. And in the spirit of patient feedback, we designed our vape packaging back in 2016, early 2017. And we were very particular at the time to make sure that we would have very clean, very professional looking packaging. We wanted to kind of reiterate that this is medicine. And frankly, we didn't want the box, if you will, to take away from the message of there's hope inside, that the pure distillate, pure cannabis derived terpenes that are in our vapes, that's what we should all be paying attention to. And with the best of intentions, we got the feedback that the box was too big. So we made the box smaller. We have recently launched a new package for our 0.6 gram vapes that is about 50% smaller than the original box. We've also taken out the plastic insert. So when you slide it open, it is just a cartridge inside of a cardboard well that sits inside of a cardboard sleeve. So like our former packaging that was 100% recyclable, this is also 100% recyclable. And I love our 0.6 gram cartridges. We're one of the only processors in the state that actually fill a 0.5 gram vial with 0.6 grams of oil, because we want everyone to be assured that they are getting a full cartridge. All of our vapes are made with Curio distillate, which is CO2 extracted specifically from our homegrown flower. It is also reinfused with cannabis-derived terpenes that are also extracted from our flower. And that is all. It is a pure product. And we hope that patients will be enticed to try it and to be loyal to our vapes by picking up one of the vape punch cards, which you'll see a picture of, wherein when you buy 5, your 6th vape is on us. And you can pick any vape that you want from the Curio Wellness line to be able to enjoy that benefit.
So in the vape conversation, we just launched a new line called Y3K. This is the t-shirt in case you see it in the store. The line is all about mood. And I think it's really common in this space to have this conversation around effects. But I, in particular, was a big stickler amongst our team of I wasn't willing to go down this road unless we could bring something totally authentic to the conversation. It's very easy to, put a sativa in a box that says happy and sort of make that connection and an assumption that those are the results you will get because of the nature of that flower. But I really wanted a much more defined product that was going to be consistent for patients every time. So we actually took a huge step here and called up our friends at SunMed and said, hey, you want to do this together? And I think it's really an awesome thing because this is what this program's all about, right? There's lots of licensees, but opportunities to work together are very exciting. So they were interested in the idea. And so this is a premium collaboration. It's their flower. Strains that you love from SunMed are extracted specifically for these 3 formulas: Power Up, Reboot, and Shutdown. And Curio does the CO2 extraction and vape formulation and distributes the product. So I think it's really exciting to see this in our state, and we're having a lot of fun working together. And I'm gonna let Rebecca tell you about the individual SKUs, and you should try all 3.
So, like Wendy said, the overarching theme of the Y3K line is mood. So, we like to say that there are 3 disposable vapes designed to carry you through your day. So, Power Up features limonene and a lesser known terpene called valencine, which helps you get that morning boost of energy and helps you stay alert. Reboot features beta caryophyllene and pinene, and that is designed to help you with that midday refresh, kind of around 3 p.m. when you're like sinking in your chair and really are like, I could just use an afternoon nap. You know, the idea is that you medicate with Reboot and it gives you that jolt of energy to take you to the rest of your day. And then Shutdown is designed to give that evening calm and is heavy in myrcene. And you know, I keep talking about patient feedback, but it's genuine, and that's really what we do what we use to explore different areas for innovation. And we did some vape studies out of our own wellness center, and we learned specifically from millennials that they want a product that is disposable, portable, and will help them get through the different stages of the day. So we went to work, we developed formulas in partnership with SunMed, and we trialed all 3 of these formulas, I would say over the end of 2019 and the end of 2020 and the beginning of 21, to really feel confident that we are marketing something that is genuine and that these formulas actually do deliver on the promise of powering you up, helping you reboot, and helping you shut down at night. So we're psyched that they are finally available, and we can't wait to hear what the patients at Mary and Main think about it. So get in touch with us at feedback@curiowellness.com, because I read those emails. The last thing I'd mention is that, and I alluded to it before, but we feel really strongly about this Curio promise. We know that medicine in the medical cannabis world is not covered by insurance, that people are using their hard-earned dollars to find an alternative for healing and for their health. So we stand behind this promise that if there is a product you try, whether it be Curio, Dixie, Kaviar, or Wana, all the brands that we manufacture in Maryland, you absolutely can bring it back to the dispensary where you purchased it and request a new product in its place, or to have your money back. And we make the dispensary whole as well, because it's important to us that, you know, Mary and Main has a relationship with Curio where we truly see each other as partners and we help each other thrive in this landscape. And I'd say lastly is Morgan, who is one of our great Curio Wellness brand ambassadors, is in the Goodnight shirt in the forefront. Karen Pumphrey, who's in the Curio shirt in the background. They both have done awesome pop-ups at Mary and Main, and I know they're excited to get back out into the world now that some of our restrictions are relaxing a bit. But our brand ambassador team are kind of our educators out in the world. And when you see them, please ask them questions about our products, ask them questions about CGMP. They, as part of their training, spend time in our facility up in Timonium. So they understand how we grow our flower, how we manufacture, and they also spend time working in our own wellness center. So they are incredible representatives of the Curio Wellness mission and everything that we stand for. And we're really excited to see patients again out in the world, and hope everybody is staying healthy out there and kind of excited to breathe some fresh air together this spring and summer.
So we've told you a lot today, and we hope that you are encouraged to learn more. We definitely would love to see you on our social channels, which you can find here. Dixie, Kaviar, and Wana are the other 3 brands that we produce, and you can find them on social as well. As Rebecca said, anything you want to tell us about products, what you're looking for, what you think is missing in the market, please feel free to send us information at feedback at curiowellness.com. And our website as well, curiowellness.com, is a massive resource. There are pages for every product on there where you can learn about their onset, their duration, their potency, their dosage form, and we encourage you to visit.
All right. Well, thank you guys for that. That was awesome, very thorough, and now we have a pretty good picture of all the different products you guys offer. But for some of these brands outside of the Curio brand, what are the differences, and why might somebody like the Dixie brand over Wana or Kaviar versus Curio?
So we're committed to bringing the best medicine to Maryland, and we're also intellectually honest with ourselves that we might not know it all. So when we've started the business, Dixie Brands out of Colorado is an incredibly well-respected, well-known manufacturer of cannabis products, and we partnered with them from day one because they have elixirs, tablets, and balms, which are 3 dosage forms that we don't make under our Curio brand. And kind of opening that door to partnering with brands from the West Coast led us to Kaviar, which is a 1.5 gram infused pre-roll cone that comes with this luxurious glass tip, as well as Wana sour chews, which offer a variety of flavors and potencies. But all 3 are incredibly well-respected brands, both in Colorado and in other states on the West Coast. They also have an ongoing commitment to medical programs, which aligns with Curio's mission to be a medicinally focused company.
Awesome. Awesome. Another thing I noticed, you guys have amazing marketing. So I'm attributing that to Wendy. How do you guys manage all of that? You come up with these new brands and you're just busting out amazing landing pages, cool experiences. The O brand had a really cool web experience attached to it. Just tell us a little bit about that and how you get through that process.
So Rebecca and I do collaborate on those things, so she does deserve some credit in this space. I think that, so probably a lot of it comes from my background. I was in television in the marketing space for many years. So I sort of apply a lot of that to what we do here. But I think that we know we have, there's a lot of voices in our space and we want to find a way to cut through, but we also want to be able to tell people like why they should care about a product, why they should pay attention to it, and what there is to learn about it. So with each product, we sit down with our agency and we sort of talk through that connective space. And so, for example, the O website that you referenced, actually, we just learned that it is going to win a national advertising award, which is pretty exciting. And if you haven't seen it, we'll make sure to get it up on the link tree on our social channel. The O lubricant that we put out, you can imagine, is for a certain activity that people do in the privacy of their own home. But we created a site that intentionally gave you more and more information on the product and how to use it and why you would use it. But as you move through the site, you were essentially pleasuring the site. And the site at the end orgasmed and gave you a coupon to go buy it. And it was pretty wild to make that choice, but it was very authentic to what the product was and quite memorable. So I think that's what we want to do. We want to sort of find authentic ways to connect with the audience, be memorable, and really educate people on what we're doing and what our products are about.
I love it. I love it. Yeah, it's innovative, and the Maryland market is new, so we need to continue to innovate and push the envelope so we can stay ahead of the curve and maybe even be leaders in this industry, whereas typically that's been on the West Coast. So yeah, I'm so excited about the future. I'm excited about these new flavors of your chews that are coming out. We love them, and we love how unique you guys have been in the market, and we're excited for what's to come. So thank you guys for your partnership. Is there anything else you'd love to tell our audience?
I'd say one other thing I would tease, and Wendy might kill me, is in the spirit of innovation, we are going to be launching a new clinical trial for a digestive health product that we're in the process of formulating. We actually have a safety study in the works right now. And we will get out to Marion, Maine, a survey where if there are patients in your community who want to be in our clinical trial, it will run for 3 months starting July 1st. Curio provides the medicine to the patients, and clinical trial participants will have to journal their experience using the medication over the course of those 3 months. And that's the information that, linking it back to the marketing, we serve all of that to our marketing team so that they understand how patients are effectively using a product, how we should be speaking about products with patients, because our goals genuinely are to educate, and they are to offer authentic alternate solutions for helping everyone feel their best every day. And we're really excited about it because just like Goodnight, it's super energizing when you get to break through to a new frontier. And we love having partners like Mary and Maine be kind of in the journey with us.
That's awesome. And guys, right now, while research is not federally supported, this is how we make products.
Exactly.
These types of studies, this is how we do it. So we need participation, and there's no need to complain about products not working if you don't participate in studies like this. This is the only way we find out. So
100%.
definitely take advantage of that when it becomes available. We'll be sure to notify everybody when it does.
Cool.
So yes, thank you guys so much for your time this evening. And everybody go back, rewind this video if you need to get their contact information. We're super excited. We always carry Curio products. So come in, ask us about them, and then also make sure to pop in whenever they do pop-ups. We have them at least every other month. Come by the store. So, all right. Okay, everyone. Well, thank you again for tuning in to another episode of The Main Line, and we will see you again next week, Wednesday at 6 p.m. Good night.
Bye. Bye.